Hello everyone, how you guys doing? I'm doing fine, thank you. My name is Ketema. I'm so happy to speak my introductory speech about the thing that happened to me in the past. If you don't mind, let me ask you a couple quick questions. How many of you had appendicitis? And how many of you have knowledge about appendicitis, early signs, symptoms, and what the cause for appendicitis? Okay, today I'm gonna discuss about my past experience, and we're gonna share some knowledge about appendicitis. I lost my appendix like in the year 2012. Exactly, you know what, guys? Exactly, we don't know how when these symptoms happen in our body, but I really recommend you guys to have basic knowledge about appendicitis and get treatment as soon as possible. Otherwise, you may suffer other severe complication, even up to death. Okay, you better check up as soon as possible when you feel something like the sign, symptom, and the cause about appendicitis. Okay, first of all, appendix is a small finger-like tubular projection off from the large intestine. Appendicitis is an inflammation of this appendix due to infection. This appendix inflammation happened to me in the year 2012. At that time, I was working two jobs, one full time during the day, and the other one I was working during the night at the nursing home. Sometimes even I go straight from one workplace to another without taking any break or any rest. At that time, in the year 2012, when I was working in graveyard at the nursing home, in the middle of the night I feel like sick, not comfortable, even not doing well. So I talked to my supervisor or my nurse about my feelings, and finally gave me some pain medication, but the pain never go away. I was struggling at that night and finished the work with pain. The next day, after I finished my graveyard work, the next day I went straight to the second job without taking a break or any rest. After I worked like for the second job, after I worked like couple hours, the pain was getting worse and worse after the time passed by. Finally, I asked my supervisor like to give permission to go home and get some sleep. After he gave me some permission like to go home and get sleep. After I arrived home, I took some pain medication and tried to get some sleep, relax, but the pain was still there. After a couple hours, I decide I need to call the 911 to get some treatment. They came and checked me, and they decided to send me hospital further treatment as emergency patient. In the hospital, they checked me, they checked my vitals and checked some pain and everything. So finally they told me to wait for the line until they call my name for further checkup. Still, seriously, still I remember at the hospital I spent the horrible night because they didn't call my name for the last 6 hours. I was in pain. I was like a emergency patient, but they didn't call my name for 6 hours. Imagine, I was as emergency patient and wait for much longer. Is it not horrible? Very horrible. Okay, anyway, at that time my pain was like 10 out of 10. It was very, very painful. Finally, they called my name after 6 hours and took me to the radiologist room for the CT scan. After a while, the radiology reviewed the CT scan image and concluded with acute appendicitis was found. Finally, the surgeon removed the appendix through some procedure under general anesthesia. Unfortunately, when the delayed diagnosis of acute appendicitis may be at risk of suffering from other severe condition. Luckily, I got treatment before appendix rupture. Appendix rupture is the worst case. It's gonna kill you. After I stayed in the hospital a couple of nights, they sent me home to get some rest and to take medication. After a month rest, follow my checkup, back to work, fully healthy and strong. Thanks to all, I really appreciate those hospital staff who saved my life. In general, the death rate in general, guys, for the death rate for patients that suffer from the occurrence are much higher than patients who are diagnosed with acute immunity on time. If you treat on time, you'll benefit, like you survive. Early detection of the condition yield early operation that allows the patient to avoid complication. So guys, I recommend you, if you have like some symptoms or pain or like sign about appendicitis, you need to go as soon as possible for treatment, for checkup. Otherwise the risk, the complication is the worst, up to like death. So it's gonna kill you. I recommend you to go hospital to check up as soon as possible. Thank you guys so much for your attention and time.